Caroline Reed was a woman who had breast cancer, and her family wanted to contribute something in her name that would mean something very special for her.
The Breast Center was the culmination of years and years of effort. It reflects a commitment to the community to provide integrated care for women from all walks of life.
Breast cancer is not a cut and dry diagnosis. It can be a very subtle finding on a mammogram or an ultrasound. At the Caroline Reed Breast Health Center, you're going to be getting somebody whose primary focus is on breast health care.
When this center was conceived, the average time from a woman finding a lump or a mammogram being abnormal to making the diagnosis was up to 10 weeks. One of the things we wanted to do with the center was to reduce that time of anxiety. If it's benign, then a woman can go back to her life, and if it's not, then we'll deal with it. In order to do that, we had to spend a lot of time developing the space and really putting in all the equipment that we felt was important for the technical aspects, but also to make the space as beautiful and as welcoming as we could, so a woman would feel that she was being cared for.
I'm Natalie Baird. I'm 40 years old, and I was diagnosed with invasive carcinoma.
My name is Xiaomong Lin. I'm 50 years old. I was diagnosed with breast cancer last year.
My name is Cheryl Nurek, and I'm 62 years young. And I had breast cancer. I had what's known as ductal carcinoma.
Being diagnosed at 39 was like putting the brakes on my life. My breast surgeon referred me to Caroline Reed, and it was like entering a different world. I came into Dr. Bailey's office, and she said, "I can get you through this in 1 year." And she did. This process has actually given me a hope in life and in living that I didn't have. I don't think I'm afraid of very much anymore.
Well, the first meeting, I met with the nurse navigator, Tammy, and they told me they will be there whenever I need them and feel free to call them. When I was going through the chemo treatment, I never know if I cough too much or if I appear to be too weak. One of my worries was whether I was able to make it. And I remember my oncologist, he was a great doctor, and I remember he said during the appointment, he said that it's not if, it's when. All this combined together just made me feel that I'm a very lucky person.
I asked every doctor why they are involved with women who have breast cancer, and they all basically have the same answer, which was, we want to help women live. You think right away you're going to die. You know, you have no idea that a small tumor may be a slow growth. You don't hear the language right away. And that's also why they provide the nurse navigator. You're never alone, never. And you never have to be afraid to say, I'm afraid to be alone, ever. And they ask you, sometimes they read your mind, and it is the most, it's just love beyond description. It really is.